Good evening, everyone. I'm Margaret Abe-Koga, Santa Clara County Supervisor for District 5, and I'd like to welcome you to our annual Town Hall meeting about our Santa Clara County budget. Thank you so much for taking the time to join us this evening. As you may be aware, our county budget is facing some significant challenges this year, including unprecedented federal cuts and significant reductions proposed by the state. I'm happy to see that there are many of you interested and engaged and want to learn about our budget process. And so thank you again for joining us this evening. With me tonight is Ezequiel Vega, our County Budget Director. He and his staff in the Office of Budget and Analysis are charged with producing and monitoring our annual budget. Ezequiel will provide a general overview of what's in the budget and how to read it. After that, he'll take questions. So if you have a question, please submit it in the Q&A box in the chat box. And please note that if we run out of time and do not get to all of your questions, we will make sure to answer them in writing and send them to you as long as we have your contact information. So with that, I'd like to hand this over to Ezequiel. Thank you so much, Ezequiel, for being here.
Thank you, Supervisor Abe-Koga. Good evening, everyone. It is always a pleasure to be able to have the opportunity to present some important budgetary information to the community. So I'll start sharing my screen with a short PowerPoint, specifically about the fiscal year 26-27 budget for the county of Santa Clara. So I began sharing my screen, and I think that all of you can see it now. So I'll start the PowerPoint slide at this point. Everyone can see it correctly, I assume, based on what I see on my screen. So I'll start with that. So as indicated before, this is a presentation about the fiscal year 26-27 budget for the county of Santa Clara, and a way that many of the services that we provide as an organization in Santa County, they could be comparable to maybe many of the services that you have seen from the local cities as well, but we vary from that as to that we are charged legally to provide many services to those that are most vulnerable in the community, including services for public safety and justice. And you see the listing of the different services that we provide in that category. As you may be familiar with other services, for example, that the cities provide, the cities are responsible for the provision of law enforcement services within their own jurisdiction, and the county is responsible for providing law enforcement services on the unincorporated part of the county. But in addition to that, under the public and safety and justice category, we also provide those services that are unique to the county that are not provided by the cities and that we provide to the entire county population. And you can see those services listed on the slide. Some of those include the jail operations, probation, and also juvenile hall, so on and so forth. And in addition to that, another important aspect of the services that we provide is providing services for the indigent population and those most vulnerable in the community for health services. This county has chosen to fulfill that obligation by operating hospitals within the communities to ensure that high quality services being provided to those in need. And you could see some of the highlights, this on the slide. And then in addition to that, you could also see that we provide services related to housing, land use, environment, and transportation. And you could see the listing of services that are provided under that category. And then in addition to that, we also provide some of the general services that you will normally see from any local government, like the cities as well, including the ones that are listed for on the slide. But you also see some unique services that the county also provides in addition to those. For example, the distribution of property taxes to other local governments. So when a property tax bill is sent to each of the different constituents in the county is responsible for ensuring that we collect those taxes and then that the property tax revenue is distributed to all the legal entities within the county. And in addition to that, we also provide services to children, seniors, and families, and some of the important services that are mostly provided through the social services agency within the county. And we also provide many other services that are not listed on these slides. And all those services are made possible by the adoption of the budget that the Board of Supervisors adopts every year in the month of June. And you can see in the slide in front of you the timeline for that process. It is always important to remember that you are an important part of that process and that you should make your opinions known and ensure that you communicate with your board officers, and also you come to some of these public hearings and meetings so that you could express your opinion as to what is important to you for those services that you receive. But just to highlight a couple of important points on this slide, the recommended budget for fiscal year 26-27 was released on May 1st. We're right now in the period of reviewing that information by the public, by the board, and we will have a budget workshop next week from May 11th through the 13th. And then there'll be questions asked by the board, by the public, feedback, and there'll be some changes to that recommended budget. And then those changes will be incorporated into a final budget that will be presented to the public hearings on June 15, 16, and 18. And the Board of Supervisors ultimately will be adopting a balanced budget that will be effective July 1st. And once that adopted budget is passed by the board in June, it will be effective July 1st, and it will be loaded into our financial system to make sure that the department school start spending those dollars to be able to provide those services that we mentioned previously. And then we will be publishing the actual adopted budget book in October, but the information that will be presented during the budget hearings will be, in essence, the information that we translated into that budget document in October. So we had seen earlier in some of the slides, some of the general services that the county provides. And in terms of the total aggregate amount of what that means in terms of dollars and cents, you could see in this slide where the money goes for the county budget. Right now, as recommended, we are recommending a total county budget of approximately $14.7 billion in appropriations. And this includes services for the different areas that you see there on the pie chart, with the majority of the appropriations or the spending authority going to the section called Health and Hospital. And that section includes not only the hospitals that we have that you know commonly, but also services provided by behavioral health, approximately 1.1 billion, public health, the hospital system, custody health, and Valley Health Plan. So that is a very key component of the overall services that we provide to the community. But it is important to remember that the majority of those services, the total 7.7 billion, is actually funded by a specific revenue that is generated by those departments for the purpose described. For example, in the hospital system, the majority of the revenue coming into that system is fully funded by charges for services for those patients that are being served in terms of billing private insurance, medical, Medicare, so on and so forth. And we also have other important elements of services here that you could see on the pie chart. So where does the money come from to be able to fund all of these? I alluded to that briefly in the previous slide. So of that total amount, we have about 13.7 billion in revenues that fund the services that you saw on the previous slide. And approximately all of that, about 30% of the revenues that we generate are derived directly or indirectly from the federal government for the provision of those services. So given that we're heavily dependent on revenue from the federal government, any type of changes that occur at that level will impact the ability of the county to be able to provide services throughout the community, and especially on that bigger component of the pie chart that you saw previously on the health and hospital system, along with behavioral health, because they're heavily dependent on medical or Medicare. So any changes that are made at the federal level heavily impact the provision of those services, and that is part of what Supervisor Abe-Koga mentioned early on, is that due to actions from the federal government, the county was facing a significant budget gap for the current fiscal year. We were estimating an approximately $787 billion deficit for fiscal year 26-27, but the recommended budget is closing that gap, and we are presenting a balanced budget. And most of that gap of $787 billion was created by the actions by the federal government with the implementation of HR1 that decreased significant revenue that will be available otherwise to the community for the provision of services. So what I wanted to show you on this slide is just a list of all the departments that make up the different area committees or the major service areas where the county groups its services, because a lot of times there are misconceptions as to what is included in many of the different categories of the previous pie charts that you saw. This is only included for you, so you have it as a reference. I'm not going to read every single aspect or every single list here, but it's just for you so that you could see it later on and be able to identify when we're talking about the health and hospital committee, for example, these are the different departments that make up that portion of the pie chart and the services that are being provided in the community. Another important aspect of this conversation of the budget is that, as you saw earlier, the overall portion of the overall size of the budget for fiscal year 27 is recommended at 14.7 billion, but only about 2.8 billion of that, it is discretionary revenue that the Board of Supervisors can actually have more say as to how to potentially spend those dollars in many different services. The rest of the revenue that we receive for provision of services is specifically earmarked or dedicated for a specific purpose. Going back to the example that we had described about the hospital system, when we receive revenue from medical, Medicare, private insurance, that is supposed to be used to cover the cost of the provision of services to patients in the hospital. The same thing on behavioral health, public health, so on and so forth. So these $2.8 billion that you see on this pie chart is what we call discretionary revenue that could potentially be used for almost any governmental purpose, but at the same time, the county also has many different restrictions. If you recall, we had seen some of the main services that the county provides are, for example, jail operations, and the jail is a mandated service. So a large portion of these discretionary revenues, since we don't have any other revenue source, have to be used for that. Also, for the provision of district attorney services, the Board of Supervisor offices, administrative functions of the county, all of those have to be funded by using some of these discretionary revenue. And as you can see on this next slide, you could see where the majority of that $2.8 billion is spent. Based on the most recent calculation for discretionary revenue, we estimate that approximately 43 cents of every dollar is spent on public safety and justice type of departments. 19 cents is spent at the hospital and health clinics. 19 cents also in behavioral health, homelessness, and other support services, which includes also social services. About 10 cents of that is spent in facilities and technology, and 8 cents in core governmental operations. That is mostly administrative in nature, including the auditor controller, the county executive, procurement, and a few other administrative departments. So that's where that discretionary revenue goes. And this is just represented in a simple format. For every dollar you spend, if you were to spend $1.43 will be going, for example, to public safety. So the majority of the funds are going to that category. And the reason for that is that a lot of the services that we are providing in that area are mandated. And since we are required to provide those services, we are allocating a large portion of discretionary revenue for those mandated services. So even though we are presenting a balanced budget for the Board of Supervisors for consideration next week as part of the budget workshops, we still have great uncertainty in future revenue amounts that the county may receive, and that is mostly due, as we discussed earlier, from aggressive actions by the federal government, including the implementation of HR1 last July, and any potential new changes that may be considered at the federal level at this point. I have heard more recently that the Trump administration is considering doing another reconciliation bill that could potentially affect the county even more significantly than is already being affected by the impacts of HR1. Also, in addition to that, the actions at the state level that have not really helped the county alleviate many of the impacts implemented by the Trump administration with the implementation of HR1 made the balancing of the budget very challenging for the current fiscal year, and we anticipate that is going to be true also for fiscal year 27-28. And then, as we know, inflation or tariff-related increases in costs and goods and services may continue to create some challenges for the county as it's going to be more expensive to provide services. Just like all of you are feeling the impacts of everything being more expensive, the county is going to also have that same uh, is going to have the same type of impact from increased costs for goods and services. And with all of the what is happening on the Middle East and the war and everything that we're seeing on the macroeconomic picture at the world stage, it is possible that an economic recession may be in the horizon. It seems that many economists have described this as a possibility for the last few years, but I think that is more and more possible that that recession could be coming in the near future. So we'll have to prepare for that for the upcoming fiscal year and also for fiscal year 27, 28. So there are major challenges, as described earlier, that will continue to affect the budget, and that it's going to be important that we stay vigilant as administrators of county resources and your taxpayer dollars to make sure that we spend them as efficiently as possible on the upcoming fiscal year, and also start planning for fiscal year 27, 28 as well. So we are open to be able to hear from you as to any suggestions that you may have, recommendations, but please get involved throughout the available opportunities that we have for public input. As you saw on the earlier slides, we will have an opportunity next week during the budget workshops, then during the budget hearings in June, and also today as well, offering this forum to be able to present some major highlights of the budget and be able to hear from you as to any specific questions that you may have. So with that, I'll conclude my presentation, and I will open it up to answer any questions you may have. So I see one question in the chat. One of the questions I see is that how many people are on the county payroll? So in the county payroll, we have approximately 23,000 full-time equivalent positions. And the next question is how many supervise or manage at least one other person who is on the county payroll? So I'm not sure exactly what that means, but I assume that the question is geared towards trying to understand the level of supervision that we have per county employee. Right now, I do not have that information, but I'll be glad to get back to you with that specific response.
Two, that there is some individual agency, like people can choose to.
Do we have any other questions, or do we have anybody else that would like to share anything with us?
So for our employees, we have this whole website that talks about the process and FAQ.
Can you talk a little bit about the reductions that we are facing and how that's impacting our services or could impact our services?
Yeah, definitely. So we are facing a reduction of approximately 787 million for fiscal year 26, 27, with many of the impacted services being in behavioral health, the majority of that being in behavioral health services, some reductions throughout the entire organization, including administration, public defender, district attorney, probation. Every single department in the county is being touched by those reductions because the magnitude of them is so big. But the largest impact that we're going to see is going to be in the area of behavioral health, not only because of the impacts of HR1, but also because of a lot of the impacts that we're going to see related to how the state recategorize the Mental Health Services Act revenue, what they are calling now Behavioral Health Services Act revenue, and we're losing significant revenue from that as well. So there will be a significant impact on services as it is, as they're describing the county recommended budget. Because as you can imagine, 787 million is a significant amount, and the majority of that impact is going to be felt, unfortunately, in the behavioral health component of the county. So it is something that we're going to have to continue monitoring. And even with those reductions, we have invested a significant amount of discretionary revenue to try to bolster and minimize some of those impacts in that area as well. But it is gonna, as I indicated before, we're gonna see significant impacts. But also, I would like to acknowledge that without the passage of Measure A, this will actually have been worse because we received, thanks to the approval of the voters, approximately 337 million in additional revenue that is going to help continue the provision of services, importantly in the hospital, health and hospital system. But yeah, I think that other than that statement, I don't have anything else to add at this point, unless you have any follow-up questions.
Clarify, you mentioned about an $800 million deficit. The 330 million coming from Measure A, will that close that 800 million, or is that after we've included the 330?
Yeah, so that is going to help us close some of that gap. Without the 337 million that we're getting from Measure A, we will actually have to make specific reductions for that approximately 800 million. So instead of having about 800 million, we have a true reduction of about 500 million instead of 800 million.
Okay, great.
Yeah.
And then, I know we just, we had a mid-year budget every year. Around February, we do a mid-year budget review and make adjustments, and we had to reduce about 200 million, I believe, that year. And then this budget is at 270 million that we're looking at in reduction. So then the remainder is potentially the next 20, what is this, 26, 27? So it would be 27, 28. Is that how it
Correct. So we
works
have
out?
cumulatively made reductions, including the reductions that we did at mid-year of approximately 500 million, and then about 300 million in addition, additional solutions were solved by Measure A. So that's about 800 million. And then for fiscal year 27, 28, we anticipate that we may have a 500 million additional budget gap. So as of right now, we are talking about a cumulative effect over the last couple of fiscal years and going into fiscal year 28 of approximately 1.3 billion altogether.
Thank you. And that was, we did have a structural deficit. Have we closed that? Like, or
For
is
fiscal
most,
year 26, 27, yes. So we have
yes.
a structurally balanced budget. So
Okay.
we have closed all that gap, yes.
So most of the reductions are due to the federal and state.
That is correct. Yeah.
Do you see opportunities for the county to look at public-private partnerships or revenue generation opportunities?
I think that there is always an opportunity, and the county is going to be exploring any and every option for fiscal year 28. And we're beginning some of that work now, even though we haven't fully completed the process for fiscal year 26, 27. We're looking into long range options, including any option that will be available for the county, because as I mentioned before, the gap that is anticipated for 28 is approximately 500 million. So that's a significant gap. So we'll be exploring every avenue. But I think, as you probably have heard, County Executive Williams, we're looking at a three-part strategy. One of them looking at local support for the continuation of services that I think has been achieved as part of the voters approving Measure A. We're looking at any operational efficiencies that we could achieve. That includes revenue enhancements, establishing partnerships with any organization where we may be able to generate revenue, and also advocating at the state level to ensure that they help us mitigate some of the impacts from the federal impacts from HR 1 and any other potential impacts that may be coming down the road.
Going back to reductions, you mentioned, and we know that behavioral health will unfortunately take some significant hits potentially with this proposal. What other areas are you seeing significant impact?
Yeah, so I think that we have impacts throughout the organization, but if I was to rank them in order, let me take a look here at the document, and I will tell you in a minute to see what that is. But in terms of impacts, I think the hospital system is going to have a significant impact as well. As you indicated earlier, we have implemented some reductions on mid-year during fiscal year 25-26 of approximately 200 million. The majority of that, about 183 million, came from the hospital system. They also proposed solutions or revenue solutions in terms of cost containment or other specific solutions of approximately another 200 million for fiscal year 26-27. And I think we're going to continue to see that into the following fiscal year. So I think that the two most significantly impacted or the areas that experience the most changes are those two specifically. One for behavioral health and also the hospital system is going to be significantly impacted. But as I mentioned before, I think we're going to see reductions throughout, but the magnitude is going to be more significant in those two areas.
I've been getting questions about Measure A and the funding from Measure A and where that's being applied when we were doing the measure. The message was that it would go to our health and hospital system. And there's been some questions about whether that's actually happening. You just stated that there will be impacts to health and hospital. So could you explain that, like how that's working or how that's going to work with Measure A funds?
Yes, so Measure A funds, as approved by the voters, they're going to be used primarily for the provision of services on the health area of the services the county provides. And there will be a presentation that is made to the Board of Supervisors specifically outlining that during the budget workshop. But based on the information of the recommended budget, some of the major areas that are going to receive that type of funding, even though this is not a special tax, but it's a general tax, and it's not allocated for specific services, but some of the target areas that we have identified include the burn center, cardiac and stroke, community health, emergency medicine, mental health services as well, nephrology, oncology, pediatrics, trauma centers, women's and maternal health. So those are some of the major categories where the revenue will be going towards. And as I identified earlier, this is not a special tax, but this will be the target and the goal of spending the dollars in those areas.
And thank you. And then the flip side to that is I've heard folks, say, well, what about other areas like public safety and some of our social services? And if I'm correct on this, the general fund actually provides about $500 million to our health and hospital system, or has. So could you explain, like, in essence, how that works, and then how Measure A, by funding health and hospital, would help the other departments that we provide services from?
Yes, so in essence, one of the things that we did strategically is that with the provision of revenue from Measure A, also some of the services that I indicated earlier are going to be funded. But at the same time, the county general fund investment that you mentioned earlier of about 500 million, we're proposing that to be reduced for fiscal year 26-27. So by doing that, we're freeing up some of the general fund dollars that were going to the hospital that will now be going to fund other services in the general fund. So that is how we are using that to leverage that funding and ensuring that we minimize the impacts on other services in the general fund.
Thank you. If the audience has more questions, please put them in chat, and I'll keep asking a few more questions in the meantime. So some folks have been concerned about layoffs, and wondering if you could share what the proposal has in terms of our employees.
Yeah, I'm sorry. Could you repeat that question? I was trying to look for the chat while you were speaking. Sorry.
Oh, sure, yes. So some folks have asked, like, does this mean that we're going to have to reduce our workforce? And I was hoping you could share if this is translating to any layoffs or how we might have to reduce workforce.
Yes, so the county is planning a reduction in workforce, obviously, because of the magnitude of the reductions is significant. The county is projecting to delete approximately 637 full-time equivalent positions. Some of those positions will be filled, but right now, based on the current plan that we have developed, and given that we had implemented a hiring freeze for the last fiscal year, where every vacancy that becomes available is evaluated before we advertise for hiring, we anticipate that every person that is in a field position currently of those 637 positions, approximately, let me look at this report, 265 are identified as being filled, but we anticipate that all of those individuals will be able to have a placement in a similar type of position or in a lower classification for which they qualify. So that's currently the plan. And obviously that has a lot of variations with many of the rules and the labor agreements that the county has with different labor groups. And there are many factors outside of our control that could affect that. But right now, if everything goes according to the way that we will plan it, everyone will have a landing spot, even though even it may not be ideal for some of them because that will mean going to a lower level position where the pay will be lower for some of them.
Thank you. I see another question in the chat box. I can read it. It says, how much does general fund funding to hospitals get reduced because of Measure A?
Yeah, so the original subsidy was about 530 million, and we are proposing to reduce that to about 459 million. So that's a reduction of approximately about 70 million, approximately. You're on mute, Supervisor.
I'm sorry. Could you share some thoughts or about our health and hospital system and how we're looking at efficiencies? So, for instance, we have 4 hospitals right now. They've been running pretty much standalone, but we're now trying to consolidate and put them under one system. Should talk about strategies like that we're looking to implement in the health and hospital area to be streamlined and cost save.
Yeah, so one of the strategies that I'm familiar with is that we're trying to use now the purchasing power of having 4 separate hospitals to be able to reduce the cost of supplies that we have, since we are a hospital system that encompasses approximately 4.7 billion in spending power and appropriations. So we're trying to leverage that and be able to renegotiate a lot of the contracts that we have with some of the suppliers for medication, for supplies, so on and so forth. So that's one of the ways that actually being a little larger, having more hospitals in play, has enabled us to be able to be more efficient with that and having more bargaining power than we had in the past.
And then by putting all of them under one umbrella, we can reduce some of the overhead overlap. Is that right?
Correct. So one of the things actually has been recommended as part of the fiscal year 26-27 budget is that we're going to be combining all of the hospitals into one fund. So by doing that, we will have a better administrative ability to be able to allocate resources across hospitals and also reduce some of the potential overhead that may be necessary to be able to manage all of them as a whole. So yeah, that's also another key important area that we believe is going to be important as part of this recommended budget.
Thank you. Another area, and this is more on the revenue generation side, but we've been, I'd say since I joined the board, looking at cost recovery measures. And could you talk a little bit about that and where we see opportunities for better cost recovery?
Yeah, so in terms of cost recovery, the county has been going after those measures since I joined the county back almost a year and a half ago. And the way that we have been approaching this is by exploring every single agreement that we have out there for where we provide services, where we're trying to ensure that the fees that we charge to those who we provide services cover the full cost of the provision of those services. So we've been implementing that throughout, including, for example, the planning department that is proposing as part of the recommended budget, having some fees that are going to be updated for fiscal year 26, 27 to get them closer to that goal of full cost recovery.
If I remember correctly, I was excited because we are also looking at, I think we may have already implemented being able to provide new services like in our animal services department and providing spaying and neutering services, which we didn't do before, but now we can. And obviously we have to charge for that, but that does help in terms of bringing in some new revenue. Is that correct?
That is correct. And actually, that was one of the things that when I first joined this community and saw that proposal, I thought that was very innovative and thinking I was out of the box because the
Oh.
county was expanding the services for the provision to the general public and throughout the county at a discounted rate that otherwise, if you or I living in this county wanted to go to a private veterinarian for those type of services, we will be paying maybe twice or three times the cost of that. So I think that that was a very good way of using the current infrastructure that we have, the staffing, and be able to offer those services to the community at a discounted rate and be able to benefit the community at the same time. Yeah.
Right. Thank you. Um, I don't see any other questions, so but please, if anyone has any more questions, please continue to put them in the chat. I'll ask, like, what are the best ways for residents to learn more about the budget? Do you have a website that has all the information? Other thoughts on how people can learn more? It is a very complex. I think it's something like 700 pages, so it is extensive, but what would be best, the good ways for the public to learn more?
Yes, we do have a website where we actually have a short video that explains the budget process itself. It also has the budget document itself, and it also has an open data portal where we are able to share information with the public about every single department's appropriations, revenues, and you could dive deeper into each of the departments if you were interested in doing that. So I think that that has been posted now in the chat. So you want to go in and look at that link, you could click on the link on the chat and be able to uh, see that information. You'll see the video, you have the budget book, you see messages from the county executive. I think that will help you get a better sense of what the budget is. And it has a very brief explanation of this very complex budget process for the county.
Thank you. And I remember we talked last year about a new budget system that you will be implementing. Is that up and running, or is that something we can look forward to? And what kind of cool features will that have?
Yeah, it is going to be something that we could look forward to. Right now, we're in the middle of trying to implement that system. And I think it's going to have a lot of cool features, as you indicate, that will be able to give us a better insight into the numbers, how they work, and be able to have a better way to interface with the public so they will be able to see the data into that open data portal. We will have something that will be new and improved. Uh, and we anticipate, given on the current implementation schedule, that we will have that system fully going live by October of this year, just before we start the new budget cycle. And we're going to be making some decisions right now as to setting up the system. And also, we're going to be replacing not only the budget system, but also the publishing system that you used to for the generation of the budget book. And we're going to be thinking of redesigning some of that so it'll be a little more user-friendly and provide more information that'll be more accessible to the public as well.
Great. I look forward to seeing that. There's another question here. With the consolidation of hospitals, an opportunity for cost reduction is to reduce the number of administrators. Do you have a plan to reduce the number of administrators?
Yeah, and I think that that's a question that probably Paul Lorenz in a different setting will be more readily available to answer. But I have seen some of the proposals where they are trying to consolidate services, trying to use that ability to consolidate the funds into one to be able to have that more of that flexibility to consolidate some of the administrative functions. So definitely something that we're exploring. I don't have any specific details with me today, but I think that is something that probably Paul Lorenz could expand more on when we discuss that as part of the budget workshop next week. But it is something definitely that we're looking at, we're exploring, and we have some specific steps that have been implemented.
Paul Lorenz is our health and hospital administrator, correct?
That is correct.
Last call for questions. Don't think I see any more. So, with that, then I will just thank you all again for participating this evening. I really do appreciate your interest in making time in your busy lives to spend a few minutes with us. And I always appreciate hearing from you, your questions, and also comments and input. If you have ideas on what we could be doing, and please tell us what your priorities are, what services you would like for us to do our best to preserve. My hope is that we are able to preserve as many services as we can. We may have to reduce them for some time, but I've been around 2 decades doing an elected office. I've seen a couple of economic cycles, and I think, it's fair to say we're on a downturn right now, but this is a point in time and things will change and will be an upswing. And so, I really don't want to eliminate programs, or want to minimize that, because once we do, it's hard to bring them back. So we will do our best to preserve as much as we can. But again, I really appreciate your input. Please, feel free to email my office directly. You can also reach out to Ezequiel and his office directly if you have any more questions. But again, this is our county budget. We serve the community. We serve all of you. And so we want to do our best to understand what your priorities and needs are. So please communicate with us. And with that, I don't see any more questions. As you can see, our email is district5@bos.sccgov.org. And just once again, to reiterate, we will do our budget hearings starting next Monday, May 11th at 1:30 in our chambers. And that usually goes through the afternoon. So we'll have Monday, Tuesday, Wednesday of next week. And then we will have another set of budget hearings in June. I believe it's the second week of June, 12, 13. So no, I forget the dates. It's that second week. 12, 13. No, I'm sorry. I think it's the week after, isn't it?
Yeah, so let me get the
15.
dates.
Is it
Yeah, June
15?
15, 16, and 18.
Yes.
Yeah.
Okay. Thank you. 15, 16, and 18. So in May, next week, the board will ask their questions, any changes that we'd like to see, any information that we'd like to have to bring back. And then we'll have a month for staff to respond to all of that. And then in June, we'll go through the budget again. And we do this by department. So every day we do a certain number of departments, and we'll go do a deeper dive. And then June, we do another set, wrap up or tie up any loose ends. And then at our last meeting in June, before we go to summer break, June 23rd, I believe it is when we'll pass the final budget. So please tune in. We take comments by Zoom at our board meetings, or in person. You're always welcome to join us. So with that, I will say thank you again. Thank you, Ezequiel and team. And please take care. And we look forward to hearing from you all. Have a good evening. Good night.
Thank you.